We are socially distanced, and we're going to be removing our masks so that you can hear us. I'm Laura Schuster, Manager of Infection Prevention.
I'm Jen Forrester. I'm an infectious disease doc.
So healthcare workers are caring for patients under droplet and contact precautions, which are typical isolation precautions that are normally followed in the hospital for other diseases other than COVID-19. So when they get home, there's a couple different things that they can do. They can either change into their clothes, their street clothes at work, and bag up their scrubs that they were wearing during the day, take them home and launder them as normal. Or when they get home, they can take off their clothes there and launder them as normal when they get home. There are no extra special precautions needed to remove COVID from clothing other than just regular detergent.
And as always, wash your hands.
Yes, please.
It depends on what you're ordering, I guess. But in general, if you have eaten there before, you should feel safe to order takeout. There are some processes, though, that when you get the food at home that you can make it safer for your family. So typically when you order takeout, there's an outside bag or box. Taking the food outside, or washing your hands, then taking the food outside of the bag or box is helpful. Removing that from the serving area, and then again washing your hands very, very well, and then serving your family is after they've washed their hands.
So clothes, again, can be washed, laundered as normal with your other clothes using regular detergent. The key is detergent. It's the same concept as when you wash your hands with soap and water. So soap has a surfactant in it, so it lifts everything off your hands, and then the water rinses it down the drain. So it's not actually killing any organisms, it's just removing it from your hands. Whereas detergent in the laundry is just removing it from your clothes.
We've done a lot right. I think the social distancing that people have done, staying at home, not traveling outside of the city or state unless it's absolutely necessary, has done a lot, and we've seen that here in the hospital. We aren't reaching those overwhelming capacities that we've seen in some other states that weren't able to do what we've done here in Cincinnati and in Ohio, which has really been helpful to our healthcare workers, keeping all of them safe, so that as we ride this out, which is going to probably be longer than maybe initially anticipated because we've done the right things, all of these healthcare workers are going to be able to take care of people as needed. So we appreciate all the work that people have done. Antibody data is for COVID-19, actually for many viral diseases, is a really difficult tool to use. It certainly is not necessarily used a lot of times for diagnosis, and we're lucky to have PCR tests available for that, which are much more accurate. Antibody tests can be helpful if they're after they've been FDA approved, et cetera, to show us what it looks like over time in a population. So we call that epidemiologic data. So it can tell us sometimes if you've been exposed, especially in people who maybe weren't symptomatic, and potentially if you're past a stage where potentially you're immune. We don't have those tools available yet, although the FDA is working on getting these tests so that over time we're able to see that in the US.
And something also interesting about that is when you look at the case definition for a COVID-19 patient, antibodies are not included in the definition in the lab testing requirements. So wearing gloves in public is not recommended, and the reason is because it actually works as a fomite. So that's something, an inanimate object that carries a pathogen. So if I touch a surface that has the virus on it, and I continue wearing those gloves throughout, for example, my trip through the grocery store, all I'm doing every time I touch something else, I'm spreading that virus all over the place. The key to this is washing your hands or using alcohol sanitizer to break that chain in transmission. That will stop you transmitting from one surface to another, not wearing gloves.